There have been proposed changes to the vaccine recommendations for our kids and for COVID that are now awaiting final CDC approval. Dr. Jessica Shepard, Chief Medical Officer of HERS, joins me now to help break this all down. Dr. Shepard, always great to have you. So a child's vaccine schedule, of course, this is something parents are always looking at. So what has changed here specifically?
Yeah, when we look at childhood vaccines, remember there's always a schedule, whether that's right at birth, going into the first year or 2 years of a child's life, and then typically having boosters. So where that discussion really relied on is looking at, should we remove that schedule, therefore giving parents the opportunity to maybe not do it by the schedule, and even maybe removing the boosters. So this is really kind of critical because parents do rely a lot on what a schedule is, what is the normal recommendation, and what the immunizations are actually important for. So I think that there are two things that parents really should pay attention to when we look at the changes in the vaccines is understanding the disease that is actually preventing against. And that's important because there are a lot of complications that can happen for certain diseases. And then also the boosters. The boosters are really important because as children go into school age, this is really where we start to see immunization making an impact because we're now in bigger groups. And when there are more people that are infected or impacted, that's where we see the biggest risk of a disease spreading, such as measles, what we've seen where people decrease the use of a vaccine. Therefore, we have an increase in a group setting.
And these changes are just incredibly difficult for parents to just keep track of everything. So we appreciate you walking us through it. I do want to ask about the Vaccine Advisory Committee voting for the COVID-19 vaccine to now be an individual choice for all Americans instead of that universal recommendation. What does that actually mean for public health? And what does that mean for people who want the shot?
Yeah, I'm actually glad that you asked the question that way as a public health issue. So going back to vaccines, the important part is that we are really not vaccinating all the time for a specific individual, which of course you are, but it really is the herd or the group mentality that the more people that are vaccinated, the decrease is what you'll see in actual hospital admissions or complications from a certain disease. So when we go to COVID being an individual type of decision, it's not saying that the individual doesn't have the choice or that the individual doesn't have the wherewithal to understand that. What we will see is a decrease in compliance or people being able to find where the vaccine is if you don't have a universal protocol. So I'll give you an example. I have a lot of doctors since these changes that when people do come in for the vaccine now, depending on the state, they now have to write a prescription. So that really adds a layer or a barrier for that patient to get an actual vaccine, or is it actually covered by insurance payers now? So these are questions that are important. And again, looking at the broad perspective of vaccines, why they're important for a population from a public health perspective.
And just to follow up on that, because we have heard some sounding the alarm about the repercussions of this, and specifically what insurance companies will do going forward, because in some communities, it will be more difficult to get the vaccine if you want one.
Oh, absolutely. If you think about when we were at the height of COVID, we really had less barriers and people could really get it wherever they could go. And so when you decrease the availability of a vaccine, it puts more questions, more obstacles. And typically what we do see in public and communities is that they'll just forget and not go get it. And that's really what creates more of the problem.
And especially for the more vulnerable populations as well.